Me on set this morning is the representative for Trinidad and Tobago and the Dutch Caribbean Islands for PAHO and the World Health Organization, Dr. Erica Wheeler. Good morning, Dr. Wheeler. Thank you for coming back this morning. Obviously, because Trinidad and Tobago has recorded its first case of the coronavirus, and we want to put people at ease by providing as much information as possible. So what are the next steps for Trinidad and Tobago?
Okay, thanks for having me again. Next steps. Now, something to explain. Trinidad and Tobago always had a pandemic influenza preparedness plan. So what PAHO has been doing is working with the ministry to review that plan and to ensure that it's COVID-19 ready. What do I mean by that? The World Health Organization and PAHO have been putting out a lot of information on the types of equipment that's needed. We know that we need personal protective equipment in the country. So it's ensuring that there's enough gloves, masks, and suits, the hazard suits, the special suits, they're called hazmat suits, ensuring that the health system is in readiness to receive that person. So now that the first case has been announced, it's about putting that plan into operation, ensuring that if people come in with suspected cases to a clinic, of course you should go to your doctor first, but should someone do that, how do you treat them? How do you isolate them from other persons? It's called triage. So you put them you direct them in a particular way so that they don't come into contact with others. Making sure that there's the hospital readiness checklist, which PAHO has provided, ensuring that the equipment in hospital, should there be a serious case, is available. It's called for palliative care, so you have the oxygen and you have everything that's necessary. Should that person develop an infection, that they be treated with antibiotics, which is not for viruses, of course. But the main thing is that you now put that plan into operation, so health workers know what they're supposed to do, how they should treat the patient, where they should isolate them, how they should equip themselves, what skills they need to be able to do that. Also for testing, CAFA has a laboratory which is already testing. There have been ongoing tests, so ensuring that there are enough diagnostic kits. PAHO has given CAFA some of those diagnostic kits. Also the lab people have been trained, so it's putting everything that's been done as part of the preparedness plan into effect. That is what it's about. So it's moving away. It's just like in a disaster. You have a disaster preparedness plan. It's sitting there, but when there is a disaster, then you have to go into action. So that's the phase that we are in now. It's actually implementing that plan in a systematic way. Everybody knows who to call if there's an emergency. The ministry has put out numbers that you can call. So that's what we're doing. We are in that phase now.
Dr. Ora spoke about the possibility of a peak if there's a mad rush for testing and persons, begin to be tested as positive, probably because, they may not have been aware. We spoke about self-medication and that kind of thing. Is that something we can anticipate now? Is that something that we see in other countries and perhaps still, even if we see it, there's no need to panic because we know what it is?
Yes, there's a rush for testing now. If you do suspect that you have COVID-19 and you call your healthcare provider and they come for you, they're the ones that will refer you for a test. I have been told that there's testing going on privately, but honestly, CAFA Laboratory is the only place where testing should be done. So it's not as if you can go to CAFA to get tested. You have to be referred for a test, and a swab is taken either from your nose or your mouth, and it's sent to the lab for testing. So there is no need for people to panic and rush for testing. They need to go through a healthcare provider. Should they go to a clinic, and we're discouraging people, as Dr. Ora said, from rushing out to hospitals and clinics, but contacting your healthcare provider or the clinic, and they can come to you and take the necessary precautions in order that everyone remains safe.
There's a question about immunity if you've recovered. So if you have contracted the coronavirus, COVID-19, and you've recovered, does that make you immune from getting it again?
So we don't have enough evidence yet of that. Remember, it is a new virus. We don't really know how it will behave. Will it behave like the flu, where it comes back every season? Will it behave, as you said, if you get it once, you won't get it again? We have no idea. We only found out about this virus in December, and we're in March. There are teams of scientists working on this virus now to get a vaccine. So we don't have enough of a history of the virus.
Yeah.
We know about the previous ones, how they behave. We know, for example, with the H1N1, it does come back every year. It's seasonal. So we can tell people, prepare, take your flu shot to reduce your chances of getting it. But right now, we don't have the science, the medical science and the knowledge to know whether you will have immunity for it once you have it.
There's a
year from now. Do you have any idea why the timeline is that long and if that could be reduced?
The timeline is that long because we need time to develop a safe vaccine and test it. So there are many clinical trials, I believe over 200 going on around the world now by scientists to actually identify what is the best possible solution, how you can come up with a vaccine. It takes time because you do have to test it and then on individuals, small numbers of people and then larger numbers of people to make sure that it is effective and importantly, safe.
Right.
You don't want to have a vaccine then that is ineffective and it causes side effects.
Right.
So that's why it takes that long.
Okay.
And quite honestly, for the flu, every year the vaccine changes a little bit because our bodies change and the virus changes.
It mutates to
yes,
right.
yes, it mutates slightly. Yes.
What about the virus and children? So we're hearing Dr. Ora said that no cases in children under 9 years of age so far. But in terms of children 9 to 12, 13, 14, what should parents look forward to and how should they treat with it?
Well, the virus would behave generally the same way with all age groups. But it is true that it is mostly older people, and in China, even people in their 70s and 80s who have underlying conditions, who are more susceptible to becoming severely ill. So it means that children can get it, but we have not seen any great evidence of it, affecting children as yet. But it doesn't mean that we can't be cautious, but the same symptoms of fever and cough and difficulty with breathing. But it has not shown itself to be something that attacks children per se. And remember that their immune system, once you're over 6, is more developed, so you would be stronger. And it is older persons whose immune systems have been compromised. So yes, it is true that it has not been seen so much in younger children, but it doesn't mean that in general children will be immune from getting it. But we're studying the virus and its course and how it behaves in the human body. And we don't have that historical knowledge that we need about the virus as yet. It is far too soon in the life of the virus and how it affects our bodies.
There's been a lot of travel between the Caribbean countries, and now that we're seeing cases in Jamaica, Guyana, St. Vincent, now Trinidad and Tobago, what is the WHO saying with regard to the Caribbean now? We spoke about Trinidad and Tobago in terms of preparedness and regional travel.
Okay, so I know that it is the governments of the Caribbean that have been taking steps when it concerns travel. As far as I'm aware, they have not stopped travel in between Caribbean countries, but of course sovereign governments are sovereign governments. We can't tell a government not to allow or to allow persons in. That is a decision they make. But we always advise from the beginning, when this public health emergency of international concern was announced, that it should not affect trade and travel, but it has, because governments have taken steps to protect their citizens, and different governments have taken different steps. Now, I do know that there's been a meeting of ministers several weeks ago where they discussed what steps should be taken, and then there was a meeting of heads of governments that was chaired by Mia Mottley, the Prime Minister of Barbados, and they spoke about coming together and having Caribbean protocols. Now, those protocols have been developed, but they are being passed around the member states for their approval. So CARICOM countries will determine what steps they will take as a region, as a CARICOM region, about travel within our borders. But we know not all countries are affected at this moment.
Can we talk a little bit about the impact of coronavirus on businesses? For example, we saw the panic buying that took place yesterday across the country. What is the impact so far? We've seen economically shifts and affecting the stock exchange and so on. But from PAHO WHO's perspective, what advice can you give with regard to that?
For businesses, well, we have put out advice for businesses on how they should treat with their employees. So we have their responsibilities both for employees not to stay away from home unless there's a good reason. They will need to check with their doctor if they suspect that they are ill, because they could have a cough or a cold or something, but it is not COVID-19. So not to jump to conclusions, but to act responsibly. I think we have to understand that this is something as a society we need to handle together. People need to do what they have to do individually. So businesses, employers need to understand that if someone falls ill, they need to check with their doctor. Should they be diagnosed, then they will have to take the necessary precautions that's given for COVID-19. So I think on Monday, I'm going to be speaking to the Chambers of Commerce about the responsibilities for employers and employees and those who have persons at home who are ill. Okay, so yes, unless we are responsible and if we abuse the situation by thinking if you're ill that you should just stay home and not know if you have COVID-19, of course it will affect business. But should that be the case, businesses have to make a decision. Should people work from home, for example, to provide them with the wherewithal for doing that if they need to work from home, and really balance the care of individuals with the requirements of the business place. So I will be having, as I said, doing a presentation for the Chambers of Commerce and going into more detail and having questions and answers on the behaving responsibly as businesses, but employees have a role to play as well.
Yeah. So